Happy morning, Zeal. So you want to look good, your teeth to look good, feel good and stay good forever. You know whom to contact. Dr.Arati here, practicing dental surgeon for over 21 years. Today I take the privilege of presenting the three main aspects of dentistry that I am sure all of you will benefit from. I believe in treating patients for their need and not for their want. They would come to me asking, I want this doctor, I want that. But that's not exactly what their teeth would need. So I'm here to educate you and make you understand what exactly the need is. So before I start, I would like you to understand the anatomy of a tooth, which is very important to understand what I'm talking. So if you take this, the first layer would be your enamel, then the dentin and the nerve. So enamel is the protective covering. It is 4 times stronger than our human bone. So you can imagine how strong that is. And if you have to get that destructed, it's really a painful job. So that's what I'm going to teach you, how to take care of it. My first LCD will concern with dental tooth decay. So I'm going to take you through the journey of how a dental decay could be a really painful and a traumatic experience. When we brush our teeth in the morning, how many of us open our eyes and we are awake when we are brushing? I bet half of us are sleepy. That's where we need to understand, open your eyes, be physically and mentally awake when you brush. You need to spend just 2 to 3 minutes on brushing and look into the mirror awareingly. So the key points which would indicate dental decay, you can just see through this later if you are not able to see it. If you find there is a stain or a small hole, that is the biggest indicator. And if you feel that the food is getting stuck, that's another indicator because that shows the hole is getting bigger. The other indicator could be sensitivity to hot and cold, which you could go through later on. And these are all the factors that show that enamel is getting damaged. That's when all the people will never have any pain actually, but that's when they need to contact me so that I can save and conserve their teeth with just a simple filling and don't allow it to get bigger. So a dental decay involving just the enamel will be painless. So it's just a filling. What happens when we neglect this? This spreads to the nerve and leads to a root canal treatment with excruciating pain. Success story, I've saved more than 1,000 teeth in the past 3 to 4 months of different age groups, including children from 2 to any age group. So that could be saved from not becoming a root canal treatment. Specific ask, connect me to any schools or any colleges or Montessori's who need a dental checkup done, dental camp conducted, so we can educate their staff and the students regarding how to protect their teeth. So the second LCD would be on fixed teeth replacement. That's called implants. This is how it is. In olden days, you just need to get a bridge done. So what used to happen? Your neighboring teeth were drilled for no reason. Why? That's because you needed to get a support to give you a tooth that's missing in the center. But now you have something called as an implant where it's nothing but getting a root fixed in the bone, which osteointegrates, which fuses with your original bone. And that implant is made up of titanium and which doesn't hinder or give any traumatic experience. And then an abutment is put and you get an individual tooth which looks like this from outside, and this is how it will be inside. So there's no need to touch your 2 neighboring teeth. So this is where people need to understand, yes, I can get my teeth replaced without any issue or trauma. And you have different kinds of implants and different strategies to get a fixed processes done. And the success story, have successfully placed over 200 implants in the past 5 months. It's a little expensive, but depending on the quality of the implant. Specific ask, connect me to any software companies or any places in and around Jayanagar, Banerghatta Road, JP Nagar, who need to get their staff and their employees educated about teeth replacement so they can understand better on how it works, because implant is still new. People don't have the knowledge on how they get it replaced. The last LCD would be about cosmetic dentistry. Who all like to look good, feel good and smile. That's when a photographer can do his job, makeup artist can do the job, but they forget the dentist is actually another makeup artist. We are here to beautify and give you a radiant smile. This is an example of how it is. You can see the teeth are either a dull appearance or they may be crooked in shape, they may be proclined, they may be inclined, crowded, overlapping, spaces between teeth. This is where we come into the picture. So if you're above the age of 18 and your parents didn't educate you about clips or braces and you never wore them, that's where I could help you into cosmetic dentistry, where without a waiting span of 2 years or 1.5 years, you can get your veneering done or zirconia crowns done, which give you a beautiful smile line. So veneering is nothing but a dental laminate. Over your existing tooth it is shaped, and a laminate, which is nothing but a veneer, is placed to give your tooth a new beautified look. But there are conditions where veneer cannot be placed. You need to put crowns, that's zirconia crowns. So this is what I needed to tell you about. And success story, I've treated cosmetic dentistry to the Kannada actress Bhavya and the Tamil Nadu actress Mrs. Lakshmi, who is even into television. Specific asked if you have any teenagers you know or any people under the age group of 20 plus, and they're very afraid to smile or get into the communicative profession because of their malaligned teeth, you know whom to contact. You can contact me so that I could help them. And last but not the least, I would expect you to follow the 5 golden rules. Brush your teeth twice. The brushing technique will be shown, and that's morning and night. You need to floss once in a day in the night before you brush. Use a homemade mouthwash, that is lukewarm water and salt. Never you go for a commercial mouthwash. It's not necessary. And then you need to gum massage, which regenerates the blood flow and helps the gum to adhere to the tooth. And finally, visit me every 3 months for a checkup and 6 months for a cleaning. Anybody, any questions? I can answer them. Anytime.
Unique of you from other dentists.
The unique thing about me is that I specified in the beginning, I take care of the need of your tooth, and I would not go as per your wishes as the want, because if I treat the need, automatically a want is covered, and once health is restored, automatically cosmetics is involved in it. It's like you achieve what you want without going through a painful process of your pocket getting pinched and your teeth undergoing a very lavish treatment. Thank you.